Okay, let's talk about something almost everyone can relate to. You're just walking along, maybe playing sports, maybe, honestly, just stepping off a curb weirdly, and bam,
Yeah.
that sudden twist, that immediate sharp pain in your ankle, that ankle roll. We've all been there. Or know someone who has, right? It happens so often.
It really does. It's genuinely one of the most common ways people injure themselves. Musculoskeletal injuries, I mean.
And the second it happens, your brain probably goes, okay, how bad is this? What do I actually do now? How do I fix this properly? Because there's so much advice floating around.
Right. Some of it's old advice, some is newer. It gets confusing.
Exactly. And that's why we wanted to do a deep dive today.
Yeah.
We've been looking at this really good evidence-based article from Physio Hub. It really helps cut through all that noise.
Yeah, it focuses on what the latest science is telling us about ankle sprains.
So our mission here is pretty simple. We want to pull out the most crucial, most research-backed stuff about ankle sprains for you. You know, what they actually are, who tends to get them.
How to tell if it might be more serious, like a fracture.
And maybe most importantly, what the really effective, up-to-date ways are to manage them and recover well. Think of this as like your shortcut to knowing how to heal right.
Okay, so let's start at the beginning. What actually is an ankle sprain, biologically speaking?
Good question.
At its core, it's an injury where the ligaments in your ankle joint, those get stretched way too far, or sometimes they even tear.
Right, and ligaments, just quickly, those are the super tough, sort of fibrous bands that connect bones together, yeah.
Yeah.
Like the body's natural stabilizers, keeping joints from moving too much.
That's a perfect way to think about it. Key stabilizers. So when you twist or roll your ankle awkwardly, you're basically forcing those ligaments beyond what they're designed to handle.
Okay.
And the source material points out something interesting. The vast majority, like 85% of ankle sprains, involve the lateral ligaments.
Ah, the ones on the outside of the ankle.
Exactly, which totally makes sense when you think about how most people roll their ankle outwards. So those ligaments take the brunt of it.
Okay, so besides road curbs, who's really at higher risk for this, statistically speaking?
Well, the research is pretty clear. Ankle sprains, they're the #2 injury for athletes right after knee problems.
Makes sense.
Yeah, and if you play team sports, court games, think basketball, volleyball, soccer, your risk goes up quite a bit.
All that quick cutting, jumping, landing, you can just picture it.
Totally. The article actually cites a big meta-analysis, Doherty and colleagues, which found indoor sports, especially basketball, have the highest rate. We're talking like 7 injuries for every 1,000 times someone plays or practices.
Wow, 7 per 1,000 exposures. That's significant.
It is, and here's something the source really hammers home. If you get a severe sprain playing one of these high-risk sports, your chance of it happening again is alarmingly high, like greater than 70%.
Over 70% chance of re-injury.
Yeah.
That stat alone just shows how vital it is to heal properly the first time.
Absolutely.
Which brings up maybe the scariest question right after it happens. Is this just a sprain, or did I actually break something? How can you even start to tell the difference?
Okay, this is super important, and let's be crystal clear up front. You need a healthcare professional for a final diagnosis. Always.
Right. No self-diagnosing.
Definitely not. But knowing the common signs can help you figure out if you need to seek that help urgently.
Okay, walk us through the typical sprain symptoms. What might you feel?
So with a sprain, you're usually looking at pain, obviously. Noticeable swelling, often some bruising develops around the joint. You might feel like the ankle is unstable, wobbly. It'll likely be tender if you touch the injured spot, and your range of motion will be limited. Some people also report hearing or feeling a pop when it happens, but not everyone gets all of these.
Okay, and how might a fracture, a break, feel or look different?
With a fracture, the pain is often described as more sudden, sharper, usually more intense right away. You might even see that the ankle looks deformed if a bone has shifted.
Oh, wow. Okay.
A big clue can be if you absolutely cannot put any weight on it. Though, gotta say, a really severe sprain can make weight-bearing tough, too.
Sure. Pain is pain.
Right. You'll also get the bruising, swelling, tenderness like a sprain, but potentially it's all just more severe.
So, okay, there's overlap, but that sudden, really sharp pain, definitely not being able to bear weight, or any kind of visible weirdness.
Yeah.
Those are major red flags. Go see someone immediately.
Absolutely. A doctor or physio will do a proper exam, and they'll almost certainly use imaging, like an x-ray, to definitively rule out a fracture. Sometimes ultrasound, CT, or MRI might be needed too. Just get it checked.
Okay, good advice. So let's say you've done that, you've got the diagnosis, it is a sprain. What's the plan then? How do you recover? Because this seems like an area where the advice has really changed over the years.
It really, really has. You probably remember the old classic acronym, RICE-E.
Oh yeah, rest, ice, compression, elevation, the go-to for basically everything.
That was the standard for ages. Then it evolved a bit to price. They added protection.
Okay, makes sense.
The idea was, protect the injured bit from further harm, especially right at the start, like the first day or 3.
So price, protection, rest, ice, compression, elevation. Can we quickly recap what each of those meant in that context?
Sure. Protection was just avoiding re-injury, maybe using crutches, maybe a brace for a bit to limit weight bearing initially. Rest was seen as vital, although the idea of relative rest, like gentle movement is okay if it doesn't hurt, started creeping in.
Got it. Don't push through pain, but maybe not total stillness.
Exactly. Ice cryotherapy, that was for pain and swelling. The old advice was often continuous, but we learned maybe short bursts are better. Compression. Using an elastic bandage to manage swelling and give some support. You want medium tension, not too tight.
Right.
And elevation, just keeping the leg up above your heart level. Gravity helps drain fluid, reduces swelling, less pain, speeds things up. Ideally, keep it elevated quite a bit in those first 24, 48 hours.
Okay, so Price added that protection layer. Logical. But the source material, the Physio Hub article, it really champions a newer approach. Police.
Yes. Police is presented now as the more beneficial, the more effective way to manage things initially. It builds on price, but makes a really critical change based on how tissues actually heal.
Okay, Police D. What's the key difference there? Is it just a cooler acronym?
Well, maybe. It stands for Protection, Optimal Loading, Ice, Compression, Elevation. So PICE are similar in principle to price, though protection in police has maybe a bit more nuance. It's about restricting harmful movements, but actually using aids to help gentle, safe movement, not just stopping all movement.
Okay, so the big change is the OL, optimal loading. What on earth does that mean, and why is it such a big deal?
This is the absolute game changer. Optimal loading is all about actively stimulating your body's own healing process through controlled, gradual movement. It's based on a concept called mechanotherapy.
Mechanotherapy. Sounds technical.
Think of it like this. You're using mechanical forces, gentle stretches, light movements, slowly adding weight back, eventually specific strengthening exercises to kind of guide and encourage the tissue to repair itself properly. It helps the new collagen fibers line up correctly. It builds muscle support around the joint, improves blood flow, which actually helps get rid of swelling, the edema. It's a shift away from just passive rest towards understanding that injured tissue actually needs active but appropriate stress to heal strong and well.
That idea, optimal loading, it leads straight into a big debate the source tackles. Is moving it early really better than just keeping it totally still?
Yeah, and the evidence the article pulls together, it strongly favors early, controlled movement. It mentions a specific study, a randomized controlled trial by Green and colleagues. They compared standard rice against rice, plus some gentle joint mobilization done by a therapist.
Passive accessory joint mobilization, okay. And what did that trial find?
The group that got the early movement, they actually needed fewer physio sessions to get back pain-free movement, specifically dorsiflexion, that's pulling your foot up.
Okay.
They also showed bigger improvements in their overall range of motion and even got their normal walking stride speed back faster than the RICE-only group.
So adding some careful movement wasn't just okay, it actually seemed to speed up recovery and make it better.
That's what the evidence strongly suggests. And there was another study mentioned, Tran et al., that basically backs this up, saying early mobilization with exercises should be seen as a core part of treating sprains effectively.
That's a pretty major change from the old just rest it mindset. Now, what about the other big pillar, icing? The source gets into some details there too, right?
Absolutely. It acknowledges, look, ice definitely helps with pain relief, and it reduces inflammation right after the injury happens. Those are well-known benefits.
Sure.
But there has been some debate, some contradictory evidence maybe, about potential downsides. Like, could too much icing mess with your neuromuscular control?
Which is how your brain tells your muscles to stabilize the joint. Yeah, that would be bad, especially with that high re-injury risk you mentioned.
Exactly. But the source points to a trial, Thane and colleagues, that specifically looked at this. They found that using cryotherapy before you start your rehab exercises is safe. And importantly, it doesn't seem to negatively affect that dynamic neuromuscular control.
Okay, that's reassuring. Good to know. And what about the how of icing? did the evidence point to a best practice?
Yes, definitely. It references another study, Bleakley et al., which found that intermittent cryotherapy, doing it in cycles, like 10 to 15 minutes on, then taking a break for an hour or two, then maybe repeating.
Okay.
That approach led to significantly better improvement in ankle pain compared to just slapping an ice pack on for a solid 20 minutes straight.
Ah, so those short bursts are actually more effective according to that study.
Seems so. It really reinforces that 10-15 minute guideline, both for effectiveness and probably safety too. Don't overdo it.
Okay, this is incredibly helpful. So pulling it all together from this deep dive into the Physio Hub source, what are the main sort of expert-backed takeaways for someone dealing with an ankle sprain right now?
Yeah, the experts behind the article really boil it down to 3 key things. First, embrace early mobilization. The science really points away from just immobilizing it. Instead, start gentle, safe, controlled movements early on, following that policey protocol. It leads to faster, better recovery.
So smart movement beats sitting still. Got it. What's number 2?
Second, use ice wisely. It's still a useful tool, don't get me wrong, for pain and swelling, but the evidence supports using it intermittently, those 10-15 minute sessions with breaks in between. Be mindful of the timing for safety and best results.
Okay, ice is good, just do it the smart way. And the third point?
And the third, maybe the most crucial one, proactively seek professional evaluation. Always, always, always go see a healthcare professional. A doctor, a physiotherapist. They're the only ones who can give you an accurate diagnosis, make absolutely sure it's not a fracture or something else complex, and set you up with a treatment plan that's right for your specific injury and your goals.
Yeah, that feels like the ultimate bottom line. Don't guess, get it checked properly. Wow, this has been super clarifying. Ankle sprains are just so common, especially if you're active. And knowing those potential warning signs for something more serious, like a fracture, just underscores that getting professional help is absolutely key.
And it's fascinating how the science has pushed our understanding forward, right? From that very passive, just rest it idea to this much more active approach with police, where optimal loading, that careful movement, is actually central to helping the tissues heal strong.
And even for something as basic seeming as ice, there's actually an evidence-based, smarter way to use it.
Exactly. Healing isn't just about passively waiting anymore. It's about actively guiding the repair process based on what we're learning from research.
So here's a final thought to maybe chew on based on all this. We've just seen how the advice for treating something as common as an ankle sprain has changed quite dramatically over time, thanks to research, moving from keep it still to move it optimally.
Yeah, it's a really clear example of how medical knowledge isn't set in stone. It evolves.
It really makes you wonder, doesn't it? What other common health advice, things we just accept as true, might be shifting right now because of new science that just hasn't quite filtered down to everyone yet?
That's a great point.
It's kind of a reminder to stay curious, maybe question things sometimes, and always try to understand the science behind the health recommendations we follow.